What is holding the veterinary profession back? Why are we under so much stress and unable to do better for our patients? Why can't we join together and advocate for change? One significant factor is a phenomenon known as do-gooder derogation. This is a social psychology concept referring to the tendency to criticize, ridicule, or demean individuals or groups who engage in morally driven, altruistic, or pro-social behavior. One example is how veterinarians who started low-cost spay-neuter clinics were viewed as harming or devaluing the profession. These do-gooders challenge social norms, threaten the status quo, and provoke feelings of guilt or defensiveness in others. Veterinarians like Dr. Jennifer Conrad, who worked tirelessly to ban declawing, was viewed as harming the profession. In the new movie American Cats, she tells the story of how at a veterinary conference, she went to sit at a table and all the other veterinarians got up and left, like a high school clique. Observing someone act altruistically can create discomfort, especially if we feel our own behavior falls short of similar moral standards. Another example is Dr. Michelle Forbes. She suffered backlash and was attacked by other veterinarians who called her gross, unprofessional, emotionally unstable, mentally ill, and banned her from veterinary Facebook groups. Her colleagues even called for her veterinary license to be revoked because she discussed problems with access to care in the veterinary profession. She was concerned with how referral practices were asking her to tell her clients that the cost would be $10,000 or more before even seeing the patient. She also has Spirit Legacy Fund, which provides care to animals in need. But instead of being praised for her work, she is viewed as someone out to cause harm to the profession. Such do-gooders may be viewed as implicitly criticizing us by acting in ways that highlight ethical or moral shortcomings. This prevents the adoption of higher welfare practices. Even though we know pigs feel pain and benefit from analgesia, AVMA policies only recommends that analgesia and anesthesia be used to castrate pigs after 14 days of age. Most pigs in the US are castrated before 3 days of age without any anesthesia. If the do-gooder challenges societal or cultural norms or an organization's norms, people may derogate them to defend the existing system. We see this in people who defend the patriarchy and attack women who accuse men of misconduct, or ask men in leadership to elevate their standards of conduct. Another example is whistleblowers who expose unethical behavior in organizations and may face ridicule or be ostracized. Those who engage in high-profile philanthropy or volunteerism may be dismissed as seeking attention rather than genuinely caring. Unfortunately, this backlash discourages moral and altruistic behavior by creating social and emotional costs for those who engage in it. And it perpetuates negative stereotypes about individuals trying to bring about positive change. And it can lead to a sense of alienation and burnout in those who are targeted. What can we do to counter do-gooder derogation? We can build communities of support among like-minded veterinarians. We can encourage open dialogue to challenge the stereotypes fueling derogation and highlight the systemic benefits of altruistic actions, rather than framing them as individual moral choices, which can reduce defensiveness. For example, instead of saying you shouldn't support traditional veterinary teaching labs that harm animals, because it's unethical and cruel to kill animals for educational purposes, which is a framing that focuses on individual morality and may lead to defensiveness among faculty, students, and institutions that see these practices as traditional or necessary. We can frame it as a systemic benefit by saying by switching to humane teaching methods, like simulation models, ethically sourced cadavers, or clinical cases of live animals in need of care, helps create veterinarians who are more skilled and compassionate, while also aligning with public expectations for ethical treatment of animals. These methods have been shown to reduce student distress, improve learning outcomes, and promote a positive image of the veterinary profession. Once we combat do-gooder derogation, maybe we can stop corporations like Cal-Maine Foods from receiving millions of dollars in bailouts for heating their avian influenza-infected flocks to death in a practice known as ventilation shutdown. Maybe veterinarians advocating for producers to put plans in place to use less cruel methods won't be barred from AVMA symposiums or be barred from speaking at AVMA conventions. Have you experienced do-gooder derogation? Tell me about it, and please like, follow, and share to hear more.